All right, good morning, everyone. Thank you for this opportunity to present our work. I have no disclosures. So simulation is widely utilized in surgical training and has been shown to improve surgical skills and confidence. And virtual reality simulators is an important tool in the simulation training, especially for trainees, as it allows them to have repeated practice in a safe environment. And while traditionally evaluation has relied on expert surgeon feedback, now with these VR simulators, we actually get a lot of immediate objective performance assessment without observer evaluation. However, it's unclear how we can utilize these objective metrics from the simulation modules from the simulators to enhance the simulation training and resident technical skills. So we wanted to explore the association between subjective observer evaluation and objective simulator metrics in a lap chole simulation module. We hypothesized that residents with higher simulation scores have better objective simulator performance metrics during a lap chole simulation module. So to do this, we collected data from all general surgery residents who completed a 2-week rotation-specific lap chole simulation module utilizing a virtual reality simulator. And their performance are evaluated by pre- and post-test at the beginning and the end of the rotation. We collected objective metrics from the simulator, and we also used validated assessment forms such as the Global Operative Assessment of Laparoscopic Skills, which is GOLS, as well as the Objective Structure Assessment of Technical Skills, which is also called OSATs. And we also used a lap chole specific evaluation form as well. Statistical analysis included Wilcoxon signed rank test, as well as Spearman correlation coefficients. So in terms of demographics, we included 14 residents in the study, and you can see a majority of them at least had some experience performing lap choles in the operating room. When you look at OSATs, we found that there were significant improvements noted in all components of the OSAT from pre-test to post-test scores by the evaluator. Similarly, on the lap chole specific evaluation form, we also saw significant improvement noted in all components of the lap chole, which included incision port placement, exposure, cystic duct dissection, cystic artery dissection, and gallbladder dissection. And lastly, using GOLS, which is more specific to laparoscopic skills, we again found significant improvement in all components from pre-test to post-test. More importantly, looking at the objective metrics, as you see this long list over here on the left-hand side, that's a lot of data we get immediately as soon as the resident completes the simulation module. And we found that the time to extract the gallbladder decreased at post-test, but the average speed of the right instrument actually also decreased, while the total number of movements as well as the total path length both decreased. So this is kind of interesting, right? So if you look at it, the residents actually, they moved less, their total path length is less, but they also moved slower. This is kind of raising an interesting concept of like, are they more cautious with their movement? Are they moving slower, but in a more deliberate way? Because clearly they're able to do the simulation module in a shorter period of time and using less movements. And when you look at the evaluator scores versus the objective metrics, again, I listed the objective metrics on the right side here for your reference. We found quite a few associations. For example, for respect for tissue and overall performance, those are associated with higher average speed of the right and left-hand instrument, while time and motion was associated with lower scores in safe cutting and safe cautery, but higher scores in safe clipping, and also speed of the left-handed instruments. When you look at the lap chole specific form, we found that exposure and cystic artery dissection was associated with lower scores in safe cutting. And lastly, looking at GOLS, we found that the higher average speed of the left-handed instrument was associated with more efficiency, better tissue handling, more autonomy, better depth perception, as well as higher total score, while the safe cutting, again, is inversely related to bimanual dexterity and autonomy. So I just breezed through over a bunch of associations. But the main point here is overall, we found that the average speed of the left-hand instrument had the most significant associations with the evaluation scores, which is actually consistent and kind of makes sense. I can't even count the number of times my attending has told me to use my left hand, so clearly it's very important. Our study is limited by the sample size as well as the retrospective nature of the analysis. And of course, there's evaluator bias because, just inherently by having a person grade the simulation assessment, you introduce subjectivity into the assessment. So in conclusion, we found that residents had significant improvement after completing the lab COLI simulation module based on both subjective evaluator score as well as objective simulator metrics. However, besides the speed of the left-handed instruments, we really didn't see other correlations that made sense, and which is kind of suggesting that these two evaluation modalities are actually potentially measuring different things, and that, different aspect of the technical skill, and should both be considered in the evaluation of resident skills and technical performance. Thank you.